Welcome, everyone. My name is Mona Drage, and I'm the director of LHL International Tuberculosis Foundation. And as Lesja said, I will be the moderator for today. We host this webinar together with TBEC and Latvian Society Against Tuberculosis, and we are really happy to see so many people joining. And most of all, we are very happy that we think that this is shows a real interest in peer support for people with TB in the region. So we have 1.5 hours. We have 5 presentations. We'll have time for questions and answers after the presentations. But you can also post your questions in the chat, and then please also write the name of the person you are addressing the question to, the speaker that you want to answer. But before we start getting into the presentations, we want to have a quick poll. Are you able to set that up, the poll?
Yeah, just a moment.
Okay, so here's the poll that we want you, it's only one question that we want you to answer. Is peer support for TB available in your context or country? So there are 3 possible answers. It's no, yes, it's available, but I've never interacted with this peer support system, or yes, it's available and I have experience in interacting with it. So if we can all submit, just to know, get a feel of the participants' prior knowledge and interaction with peer support. How is it going with the answers?
Yeah, it is almost 70%.
Okay.
So let's give 30 seconds and we will close the poll.
Great. Yeah, I can see there is a request to mute microphones.
So we close the poll.
Thank you. Let's see how the answers come out. Okay, so 16% has answered there's no peer support in their context. 32, yes, it's available, but they've never interacted with it. And 52, that it's available and they've experienced. That's quite interesting. So it's like half and half with participants that have actually been part or interacted with peer support, and half that have not. Thank you. The first speaker of today is my colleague Laila. She will make a brief introduction about why we are having this webinar and about the TB situation and the need for peer support in the WHO European region. So when Laila's presentation is coming up, please make sure you choose your preferred language on the top bar so that you can make sure you watch it either in English or in Russian.
Thank you, Mona. Hi, everyone. Can I have my presentation, please? There you go. Thank you. So the WHO European region is really vast and diverse. It covers 53 countries across Europe and Central Asia and have 941 million people. So a lot of differences, but we also share some commonalities. LHL International have quite a vast experience with peer work. We have had a peer support service in Norway for the past 15 years. We also have long-term partnerships with TB survivor organizations in other countries, mainly sub-Saharan Africa. And we have done a lot to ensure the availability of easy to understand and accessible information about TB that covers all the questions a person with TB might have, so not just the medical issues. We also train health workers and peers in good communication. Next slide, please. In 2024, we established the TB Across Network. The network aims to foster more learning and sharing of knowledge within the region with an emphasis on people-centered care. And this year, our main focus has been peer work. Next slide, please. So how many people fall ill with TB in our region? In 2024, which is the latest number that we have, it was 204,000 people, and among them 23,000 people living with HIV and 55,000 people with drug-resistant TB. And our region actually has 21% of all MDR cases globally. And as you can see, TB incidence has decreased over the last years, but we are probably not reaching the SDG target. Next slide, please. So who are the people with TB in our region? Many of them, we really don't know who they are, as 1 in 5 go undiagnosed. But we know that 60% of all people with co-infection are not on ART, and it affects young people. The highest notification rate is among the age 25 to 44. There is also a large variety in men and women notified, from almost even to up to 3 times more men than women in some countries. And as we know, TB affects vulnerable populations, also in low-income countries. Next slide, please. So do they get better? How well do we treat people in our region? As you can see, the treatment success is below the global target of 90%, and we do a lot worse than other regions and worse than the global average. But there is, of course, large country variations here. Next slide, please. So what can we do better? There is, of course, a lot we can do to ensure access to new drugs and diagnostics and so on. But now we are going to discuss what is often less talked about. Love, empathy, and care were some of the things that came up when we thought of the word peer support in the workshop we recently had in Oslo. So let's have that in mind as we go forward with the presentations here today. Thank you.
Thank you, Laila, for setting the stage. I think before we go into the next speaker, we would like to have a group photo. So if people could turn on their cameras, then I think TBEC knows how to make a photo of all the beautiful participants.
Yes, I believe Alia is doing photo. Please let us know when we are finished with photo. It's so nice to see everyone. Keep smiling, you look so great. Alia, are we fine? Okay.
Yes. Thank you very
so
much.
Okay. Thank you. Now we move on to somebody with first-hand experience with TB and with being a peer for other people. I'm very happy to invite Alexander Zalivskis to talk about why he became a peer. Alexander, please go ahead.
Okay. Good afternoon, everyone. First of all, I would like to welcome all of you and say that it is a great honor and a great pleasure for me to be here today and have the opportunity to share my story with you. I thought that today it would be better to simply talk to you from the heart about my own experience, about how I ended up here, and about what peer support means to me. I'm very happy to see people I already know personally, and also to have the opportunity to meet those of you I haven't met yet. I myself went through tuberculosis. It was a long and very difficult treatment journey. I don't want to focus too much on the medical side of my story today. Our time is limited, and I think today is really about something else. What I learned from my own experience is that tuberculosis is not only a disease of the body, it can have a very strong impact on a person's mental and emotional well-being. During my illness, I went through many different emotions, from relief to disappointment, from hope to confusion and fear. And only when I understood my diagnosis, started to understand what was happening to me, and saw that the treatment was actually working, I started to feel calmer. Today, I try to look at this experience in a positive way. Although the journey was extremely difficult, and there were moments when I was really at the edge of what I could cope with, I now understand that this experience changed me in many ways. There is a simple saying, what doesn't kill you makes you stronger. It may sound a little cliche, but in my case, it really does make sense. The disease forced me to rethink many things, to reconsider my priorities, and to look differently at people and at life in general. I became better at understanding other people's pain, anxiety, and struggles. And I think that it is only the beginning of what I gained from this experience. I first learned about peer support while I was receiving treatment in hospital. I was very interested in what was happening to me. I wanted to understand the process. I asked questions and I was open to communicating with the medical staff. It was important for me to know as much as possible and to understand what was happening. One day, my doctor came into my room and told me about a project whose goal was to support other people going through a similar experience. I immediately became interested. I thought if I have been through this myself and I have my own experience, and if I have something I can share, then why not to try to pass that experience on to someone else? For me, the main motivation was simply to help other people. The support that other people gave me during my illness should not stop with me. If the support I once received can help even one person go through this journey a little more easily, then it already has meaning. I have always believed that if something I do can change someone's life, or even help just one person, then it is worth doing. So I agreed to take part in this initiative. And honestly, at the beginning, I never expected it to grow into something this big. I didn't imagine conferences, working groups, constant exchange of ideas, or international communication. Now I really enjoy seeing how this project is developing and having the opportunity to contribute to it myself. So, what do I think peer support can offer to a person living with TB? First of all, the feeling that you are not alone. A healthcare professional has professional knowledge about um, it can answer a huge number of questions about treatment, but a peer has a completely different resource, lived experience. Sometimes a person needs to talk not only about their treatment, but also about what is happening inside them. They may want to ask, will I ever be able to go back to a normal life? What will happen to my job? How do I tell other people about this? What if people find out? How do I deal with stigma, etc.? There are questions that people may simply be afraid to ask a doctor. It can be a fear of death, anxiety about the future, shame, fear of being judged, or simply the feeling that life will never be the same again after the disease. And this is where talking to someone who has been through a similar experience can have a completely different kind of impact. But a peer does not replace a doctor. I think this is very important. A peer should not give medical advice instead of a healthcare professional. The role of peer is different. It is about being there, listening, sharing personal experience, helping someone understand their feelings and showing them that what they are going through is understandable. It is about reminding that life continues after the diagnosis. For me, peer support today is about passing on the understanding and support that once helped me myself. It is not about saying I know better. It is more about saying I've been there. I know difficult. I know how difficult it can be. You're not alone. Let's try to get through this together. If I think about the past year, I believe we have done a huge amount of work. It has been a year of learning, brainstorming, discussions, looking for solutions, and sometimes discovering new questions that we still need to answer. Our project is still young. We are not a decades-old program, and we have not yet helped huge numbers of people. In many ways, we are building this path ourselves. But I think that is also the value of our experience. We are not simply copying a really made model. We are thinking, discussing, making mistakes, and learning how to make peer support a truly effective tool. I would also like to say a huge thank you to our whole team. I can see how committed everyone is, how much effort people are putting into this work, and how much each person understands their role and the importance of their contribution. Today, we already have colleagues who are directly working with people and providing support. We are receiving feedback that our work has been useful. We are becoming more visible, talking about what we do and creating a foundation for further development. And I think this is only the beginning. Great things rarely happen overnight. They take time. Over the past year, I have also met many people who share the same values and ideas. I have heard many stories that were similar to mine, but at the same time completely different. This helped me see the bigger picture to understand how peer support is developing in other countries and organizations and where we might eventually go. Of course, there have been also challenges. I have learned one simple thing. Helping someone is not as easy as it may look from the outside. Behind every diagnosis, there are so many questions that are not always visible for the healthcare system. A person may not only be thinking about how to complete their treatment, they may be thinking, will I be able to go back to work? What if other people find out? How do I deal with stigma? What will happen to my family? And so on. And perhaps the most frightening question, am I going to survive? Once you understand the scale of these questions, it becomes obvious that medical care is sometimes not enough. People need support throughout their whole journey. For a peer, one of the most difficult things is learning how to find the right balance between being supportive and wanting to tell someone what do you think about they should do. But peer support is not about living someone else's life for them. It's about being there and helping them find their own strength and their own way forward. I have also realized how important practice is. The more people you talk to, the more different situations you see. And the more you understand how the system works, the better you understand your own role. We don't learn only when everything goes well. Sometimes we learn the most when we face difficulties. This past year has also changed the way I personally look at TB. Before, I was simply someone who had faced the disease and was trying to overcome it. Today, I see TB much more broadly. Behind every diagnosis, I see a person, their family, their fears, their work, their plans, and their future. And I think the most important lesson this year taught me is actually very simple. The person is not alone, and their personal experience of overcoming difficulties has real value for other people. That is why I believe countries should continue developing peer support. Um, Tuberculosis is still a very real problem. There are people who need not only medical treatment but also human support. I know this not only from statistics, I know it from my own experience because I was once a person who needed exactly that kind of support. But for peer support to really work, it cannot simply become a formality. We need a real support mechanisms, okay? We need to train peers, help them develop their skills, give them opportunities to exchange experiences, provide them with the support they need, and most importantly, recognize the value of their role. I'm just finishing. Because the person with lived experience is not simply a former patient. They are a person with unique knowledge that cannot be gained from a textbook. We can't help absolutely everyone, but we can help the people who are looking for support, who are ready to accept it, and who simply need someone beside them. For me, volunteering and the peer support are based on some very simple principles: voluntariness, equality, and social value. But behind all these words, there is probably one more thing: human connection. Sometimes a person does not need someone to solve all their problems for them. Sometimes they simply need someone to say, I understand you. I've been through this too. You are not alone. Let's try to get through this together. Thank you very much for giving me the opportunity to share my story. And thank you to everyone who is here today and continues to do this important work. Thank you.
Thank you so much, Alexander. It's so inspiring to hear you talk. I think you really laid the foundation for this. The rest of the webinar, you sort of covered all the topics, but you said one very important thing: we still need to learn from each other. We need to make mistakes. We need to move in different directions and see what works within our context. And that is exactly why we're doing this webinar. So thank you. Every time you speak, you push the agenda one step forward. So thank you for this.
Thank you.
So in the workshop in Oslo, we saw that peer support can look quite different in different contexts. And we have asked Bianca Nitoi from Association for Supporting Patients with MDR-TB in Romania to give us an overview of how peer support currently looks like in the region. Bianca?
Yes, thank you, Mona. Thank you for the presentation. Thank you, Alexander, for sharing your story with us. Thank you for inviting us into your reality, and thank you for all the participants of being here today. Let's take a look on what peer support is, how can we find it in the region, and which are its functions, because peer support came as a response, as an answer to the most important questions: what can we do better, and how can we do the persons with TB path an easier one. Next slide. When we think of the TB services, we first think of the medical services. We are also familiarized with the social and psychological services, and also the economical support that some of the persons with TB can access. And what is peer support in this TB setting? Peer support is, the simplified definition is as follows. It needs two persons. One person is a TB survivor, and the other person is a person who is currently having TB. They interact, they have either a singular interaction, or it's preferably to have a multiple interaction, a recurrent interaction, and they create a connection, a relationship. And this connection, it becomes the base, the strength for the person who is currently having TB. They get their information from their support advices. The similarity is the key in peer support. The fact that the TB survivor have had already a TB diagnosis, they know which are the steps and barriers towards recovery. This makes peer support a type of service that neither a doctor, a psychologist, or a social worker can cover. Sometimes when we feel that the person in front of us is similar to us, we can, the chances are higher to trust them, to listen to them, to relate to them. And the math becomes simpler. If that person managed to successfully go through the same challenges that I'm going, then I can do that too. And the similarity can not only be about the TB diagnosis, we can extend it. They can have in common same culture, same ethnicity, same language or share backgrounds as migrant or refugee status, incarceration, or drug use. Next slide, please. Here it is in which forms we can find peer support in the region. And I'm talking about the 14 countries who shared their experience with us at the workshop in Oslo. Right now, the peer support in neither of the countries is part of the public sector. Where peer support exists, it is mainly project-based or and implemented by NGOs, but non-governmental organizations. It's still an emerging field, and this means that we can find different grades of implementation. People, organizations adapted and modified the peer support. In some countries, it is called peer support. In others, they implement activities that only partially overlap what peer support means. One of the forms that it can be implemented is by visits. The peer supporter visits the person who is currently having TB either in the hospital, they have a walk in the city, or at home. Face-to-face, there are some countries who organize support group sessions, or there are even meetings only for the peers. And when this face-to-face is not available, we adapted, we found other solutions. And the communication through phone is one of them, either through calls or through messages. In some countries, there is already implemented video-supported treatment, and that can not only be about supervising what if the current person with having TB is administrating the treatment, it can also become an interaction of support and genuinely being interested in that person experience. Other online modes that are used in the region is a Facebook group. People can post their questions, share stories. In some countries, we can find apps. So the TB survivor and the person who is currently having TB, they can communicate either audio or through chat through those apps. AI is also explored, and it's curious to see how can AI complement what the peer supporter already does. And only partially it fits the definition of peer support, the idea of sharing articles, the stories of TB survivors. So a person who is currently having TB, when they are reading that story, they can get that feeling that they are not the only one who are going through that. Next slide, please. Why are there so many ways? Can you go back, please? Yes, here is perfect. Thank you. Why are there so many types of activities and implementation? Some of them totally fitting the general definition, some only partially, because the answer to that question of how can we do the person's TB path an easier one, it's contextual. It both depends on the needs of the person who is having TB and the resources that we as organization have. And here are the characteristics that can influence on which type of activity we implement. The availability of TB survivors, especially in the countries with low TB incidence, it's harder to create that relationship with TB survivors who wants to become peer. And if TB survivors are not available or still we didn't have that time to build a relationship, then part of the activities of peer support activities can be done by the community leaders, nurses, outreach workers, NGOs, volunteers. Another characteristic that can influence us is being digital or face-to-face. Sometimes face-to-face is preferred, but only digital is possible. For example, when the person with TB is living in a really remote area. Real-time versus asynchronous. Real-time requires both of the persons to be present at a specific time, but for example, messages can offer us the chance of answering to messages only when we have availability. And of course, costs were in the minds of all of us. we can implement different types of activities depending on their costs and the financial resources that we have. Next slide. In order to understand better what peer support is and to implement it in our countries and to advocate for it, to be a part of the TB services packages, we can take a look also on the functions that it covers. Alexander's mentioned them wonderfully. One of the first functions is the emotional one. So the peer supporter transmits this message of, I get what you are going through. How does they do that? By being available, showing empathy, understanding, being there. The second function, the informational one. A person who recently received a TB diagnosis has a lot of questions, and we know that the healthcare workers can be overloaded with work. So the peer support can cover some of the answers. Of course, not all of them, but some of their answers. They can reassure and even challenge some of the myths related to a TB diagnosis. And the third function is the practical support. The peer supporter transmits the message that you don't have to figure this out alone. Let us work together through it. How can they do that? By simply sending a message, for example, in the morning of a scheduled appointment, or to explain how the system, the health system works, or to go together to the dispensary if the person who is having TB never been there. Next slide, please. Let's remain after this synthesizing of a definition, and we've seen how peer support is in all the countries with these three messages that the peer supporter transmits to the person who is currently having TB. I get what you are going through. Here is what to expect, and you do not have to figure this out alone. Let us work together through it. Thank you.
Thank you so much, Bianca, for giving us this very comprehensive and broad overview. And we see that peer work comes in many different shapes and colors, and we can all do a little bit of it, take some aspects and implement it. So from this overview, we'll now go into some more concrete examples. First, we'll have an example from Moldova. Irina Mutruc from the NGO Sperranta Terrei. They're doing a lot of great work in identifying the right peers and training them, as well as ensuring their well-being whilst being peers. So Irina, over to you.
Yeah.
And remember to put questions in the chat if you have any. That's for all. Yes, Irina.
Hello, everybody. I'm so happy to represent the organization I'm working for. And so today I am representing Sperranta Terrei. It's an NGO that exists for more than 20 years. And we're trying to do our best to support TB people in their treatment. The president of the organization is Fyodora Rodukova, who is a doctor with a huge experience in this field, and the vice president is Asma Henry, who is an American citizen and is trying her best to motivate people to donate and support our work as much as she can and they can. Next slide, please. So, Sperranta Terrei has been dedicated to tuberculosis control in Moldova since 2006. And we are based in Belts. Our community operations span the municipalities, surrounding districts, and a separate region in Moldova that is named Transnistria. We focus heavily on treatment adherence and the socioeconomic integration of TB patients. And in these 20 years, as you see, we had about 150 moderators or peers as we can. Of course, they are not all former TB people. However, as Bianca mentioned, not always TB people are available to get involved into the work. That's why at the beginning there were mainly health workers, nurses, people that were relatives of TB patients and were quite motivated to get involved into this work, understanding how important it is to support TB people in directed observed therapy. So during these 20 years, we have managed to support in treatment about 1,800 patients, and more than 8,000 were screened since 2021 in 6 districts. Next slide, please. A very important aspect that I forgot to mention is that our experience was highly appreciated by prestigious prizes like Tuberculosis Survival Prize in 2008 and the prestigious Cochrane Prize in 2016. So we also operate a center, a TB center, that is mainly dedicated to patients for training, counseling, and resource distribution. And one of the main aspects that we are focusing, and one of the core mission, is to empower individuals who have successfully completed TB treatment and who would like to support the others, offering, as Alexander mentioned, an emotional support and being a real example for the ones who are in treatment to understand that it is possible to get to the end and it is possible to fight the disease. So we identify usually people that while they are still completing their treatment and trying to convince to speak to them and try to motivate them to continue to support the others after they finish the treatment. They have to, they have to have a stable health status, a strong history of adherence. No,
Are the
actually,
organizers able to mute the person who's talking?
Yeah, we are on mute. Sorry, Irina.
After having identified people that are motivated and would like to get involved into this work, we are organizing a sort of training for them. Next slide, please. So we are trying to instruct them, to inform them, and to describe them what are the main activities that they would be involved into. And as you see, we are trying to have different approaches, including the ones that were mentioned by Bianca, having TB clubs, having discussions with peers, offering them the possibility to bring their own examples, to describe their own experience, and to share it with the others. And also, we have what is specific for our organization is that we are mainly focused on home visits. Next slide, please. That's why the first and the most important part of our training is based mainly on trying to understand, to explain to the future peers what are the main principles of the activity. And of course, so our training is divided into several specific activities, like 1 or 2 days are dedicated to understanding peer-to-peer boundaries and principles of confidentiality and respect. 2-3 days are dedicated to try to explain to future peers the most important information about symptoms, transmission, side effects that are really very important, because quite often patients have questions and they need answers. And what is important to highlight is that peers usually know how to speak in their own language, bringing their own experience and examples. A very important part of training is also developing communication skills. We know that people can be quite nervous, stressed, shocked, frustrated, and they need someone close to them, ready to listen to them, ready to calm them, ready to explain to them some of their fears and of their feelings that they are living at the moment. That's why communication skills are very important, and we are trying to explain to peers how to develop active listening, empathy, motivational interviewing, and how to solve conflicts in case the patients encounter some. Next slide, please. Another aspect is field internship or practical application. So after the training that the peers follow during several days, they have as well a kind of internship, a field internship that they have to do in the field. So that means they go home to patients, they support them, and they are always assisted by professionals who supervise the work, give them some advice, or help them in situations when they don't know how to behave or how to solve some issues that they encounter in their work. So that means as well some practical activities, how to complete the data or how to complete the forms. One of the most important let us say, approach in our activity is to try not to burden the peers with too much paperwork. And that's why our forms that they have to fill are very simple, very accessible, and easy to complete. So quite often, the ones who assist the peers try to help them in this, and only if there are some questions, extra questions. So then we interfere and try to find out some other details. But the peers, in fact, are mainly focused on supporting the patients and they are not burdened with the paperwork. And of course, we have always continuous and systematical discussions with the peers in order to explain or to discuss with them some complicated situations in case they encounter them. Next slide, please. So another, let us say, goal for us is to avoid burnout. That's why we try to organize the work of our peers in order not to let them have more than 5 patients to support. As I mentioned before, usually they are focused on home visits. So they do visit patients at home because we think that's really important. For TB patients, it's easier to ask questions, to discuss with their peer when they are in their own comfortable environment. That's why our peers, they go home and visit the TB patients at home, and in the same time offer DOT support, so giving them pills. That's why so the peers don't have more than 5 patients for them to be able to cover the necessities or the needs of the patients. Another important aspect is that monthly, we organize meetings when peers cover the specific cases and some problems they encounter. And of course, we try to monitor regularly the emotional state or the well-being of the peer in order to avoid the burnout. Next slide, please. So we also try to establish some specific rules in their work with the peers, to organize different retreats and meetings with the peers in order to make them feel comfortable and to have their own personal time and me time, and to have some rest in case they need. What is really very important, so next time, please, I'll try just to fit to the time. is that our organization has a huge network with different professionals from different fields that allow us to offer psychosocial support. That means quite often the organization helps the patients to solve different problems from different aspects, not dealing just with their treatment, but also with stigma, conflicts that they have in the family, working with their family members as well, trying to solve their legal or material assistance. That means offering them support in restoring their IDs, for example, or trying to help them have some material financial support from other people as well in case they need. All in all, so all together, the organization is doing a huge work, and our results are a vivid example or a vivid proof that we are doing great. So, and I'm glad that today we had the experience or the chance to share our experience. Also, I would like just to add at the end that our peers get paid monthly, thanks to the donations that we get from the project that is on a global giving platform, and that motivates them as well, because quite often this could be just one of the source of survival for some of them, having difficulties in getting hired after having been ill with TB. Thank you very much, and hope that our experience will be a good example for the others. Thank you.
Thank you so much, Irina. It's really best practice you are sharing with us. I hope it can inspire others. At least it gives us something to stretch for ideas of how to do it better, because you really have a comprehensive approach. We are going forward to another example. In Armenia, they are in the midst of developing a transition plan for the Global Fund. And they are a very great example on how civil society and government can work closely together to strengthen people-centered care and peer support. So I want to welcome Hripsime Atoyan from the Ministry of Health and Armenian CCM, and Nairuhi Safaryan from Real World, Real People NGO. Please go ahead.
Thank you, Mona, and good morning, everyone. I am very pleased to be here and to share our experience of developing peer-led TB support in Armenia. I will start with a brief overview of the TB situation and explain how our model works in practice. And then Hripsime will continue with the broader system perspective. Let's start with a little context. Next slide, please. In 2025, Armenia registered 417 TB cases compared with 406 in 2024. Treatment success for drug-sensitive TB was 84%, while for MDR-TB it was 69%. And one of our main concerns is loss to follow-up among people with MDR-TB, which was 21%. These numbers show us that medical treatment alone is not always enough, and we need to have some social, psychological, and peer support too. During a long period of treatment, people may face social, psychosocial, financial, and family-related challenges too. And this is where peer and psychosocial support becomes very important. Next slide, please. And we started our program, we started implementing our program model in February 2025. It combines the public health system with civil society support. On the government side, the National TB Program and the National Center for Infectious Diseases provide medical and psychosocial services. There is also a monthly cash incentive to support treatment adherence, and TB cabinet nurses work across primary healthcare facilities. And our NGO provides community-based and psychosocial support through a small 3-person team. We have only one peer counselor, one social worker, and one psychologist. And our peer counselor is a person with lived experience of TB. This shared experience helps build trust because patients can speak with someone who understands what TB treatment means in real life. The social worker addresses social needs, benefits, employment, and family-related issues, while the psychologist provides counseling and therapy when needed. And I would also like to emphasize that our peer counselor is not volunteer. The peer counselor is a full member of our professional team and works together with the social worker and psychologist. The program can support up to 500 patients per year, with priority given to people with drug-resistant TB. Next slide, please. Now let me show you that what this model looks like in practice. In 2025, 291 patients were reached through our peer and psychosocial support program. Treatment adherence was also supported through different approaches. 108 out of 280 drug-sensitive TB patients received SMS or family-supported treatment, and 47 patients used video-supported treatment, compared with 20 in 2024. I would also like to share some more recent data specifically about peer support. We currently have only one peer counselor in this year too. And in the first 6 months of 2026, our peer counselor provided 203 peer support services to 141 people, including 109 new beneficiaries. Another important part of our work is our self-help groups, facilitated by our peer counselor, both in Yerevan and in the regions too. During the first half of 2026, we organized 6 self-help groups with 37 participants, including people with TB and their family members too. These groups create a safe space where people can meet others with a similar experience. And they help people accept their TB diagnosis more easily, feel less isolation, and support better treatment adherence and more consistent use of medication. We are also beginning to see encouraging results. In our review of the first half of 2026, together with the National Center of Infectious Diseases, we found that treatment interruptions and non-adherence had decreased by around 50% compared with 2024. Of course, we cannot attribute this improvement to peer support alone, because peer support is part of broader package of care. But these results are encouraging and show us that the value of comparing peer, social, and psychosocial support. And now I would like to hand over to Hripsime. Please, Hripsime, over to you. Thank you.
Thank you, Nairuhi, and all the colleagues for sharing your personal and organizational experiences. It's quite motivating. So please, next slide. I will start from there. So I will talk about more systematically how we are working. So the peer support is quite new for Armenia. not a new concept, but new for integration. But before that, we had some experiences. For example, for many years, and also for this year, we have a TB patient or family member or a person who already cured from TB in country coordinating mechanism. And also we are encouraging them to participate in working groups, because in working groups are working more dynamically and can have more impact. So currently we have also a CCM member, and also we had the experience that one peer social worker was working in the infection. You cannot hear me?
We can hear you, but not as well as we heard Nairuhi.
Yeah, the voice is not very clear, you know.
Maybe you can come a bit closer to your mic.
Yes, but I think it's because of my internet, sorry. So, next slide, please.
Switch off the camera.
Okay, I'll try. Okay. So what's the main problem? That currently Armenia is in the transitioning period from the Global Fund grant, and like in the end of 2027, the HIV component will be stopped, and in the end of 2030, the TB component. And before several years ago, we already had transition plan, but we are like updating it each year. And the main problem is that as the HIV grant is finishing, many parts which was covering the co-infections will be moved out, and also the TB grant is shortened. So, and several international donors also gone. So we have some budget limitations, and more budget is going to the medical support than the social. So we are currently in the situation that trying to solve these issues. And for now, the peer support is not in the budget. So we are working on that to understand how we can make it. Next slide, please. So what we are doing now to have better results, now we have a new transition working group in CCM, which is working on updating all the format, and also the TB support part will be one of the main TB components in it. And when the group will finish the whole work, the CCM will confirm this, and we will share with Global Fund. And also it will be more important part of the grant application, and also the policies in the government policies. Next slide, please. So I will not talk much about this. We already heard this, and the main problem currently is that we have some migrants that is really difficult to work with them, and we are trying to not lose them in follow-up. And also we have a limited budget for peer support. You see that we have only one peer counselor because of limitation of the budget, but we hope we will have better situation in the next years. So that's all. And if you have questions, me and Nairuhi will be happy to answer.
Thank you, Hripsime and Nairuhi. I think this work really resonates with a lot of other countries also in the region that are facing the transitioning out of the Global Fund. And I hope there's some inspiration in this for others. We really need to ensure that there are good models that can be included in national policy and national budgets when Global Fund is transitioning, and how to do that. Yeah. So for our last presentation today, we will hear from TB People Georgia. Marina Chokheli is here to speak about the work that they have done so far with peer support in Georgia. but also how they now are facing some severe challenges. Marina?
Thank you very much for inviting me and for having me during this, very interesting workshop. Yeah, so sorry for sorry for some, let's say, negative or, not positive, last presentation for today, but I try to be positive as well, because we understand that it's just a permanent critical situation which happening in Georgia, but it will change anytime soon. We are fighting for it and we hope for it, and not just hope, but we are work hard for it. So in terms of TB people, I think everyone knows TB people. We're part of big family of TB people family. It's Georgian organization, but of course we are in very close cooperation with global TB, with regional TB, and with other TB organizations in different countries. In terms of our work focused on different directions. We actively, me personally and executive director of TB People, Nicholas Mirzashvili, are members of CCM. So we very closely used to work with stakeholders on different level. Currently, it's changed even on legislative level, and it's less effective and less, let's say, organizing less times, but in some cases we of course using this mechanism as well, and using this mechanism very effectively. We also of course use and still providing support of TB patients in many directions, including, of course, and main our support is peer-to-peer, support. Along with this, we are also focusing our work on intellectual property rights and patent opposition for ensure access to innovative drugs available for our TB patients, which, it's also very critical and very important work. Our work not only focused on TB in Georgia, we are also used to had some projects focused on HIV and cancer, and how many links are among TB patients with HIV and TB, and how important is to, let's say, wide our work and focus our work on these directions as well. So in terms of challenges in Georgia currently, it's really very hard to explain everything in more than 8 minutes, but in one sentence, I can say that in Georgia for the last 2 years, we adopted more legislation, which we adopted in Russia for 12 plus years. So I guess you understand with this one sentence situation which happened in Georgia, and after this legislation adopted and implemented, 99% of NGOs just running out of any financial support, closed or operating, let's say, underground, because we understand that there are people who need some more support than we are, because even without any
Maria, I'm
financial
very
support.
sorry. Maria, I'm very
Yeah.
sorry. Can you please let us know when we should change the slide, because we don't know.
Okay. Yeah.
Okay, thank
Thank you. Yeah. Sorry. It's I became emotional sometimes, because still I can't even believe that it's our new reality. I don't believe that Georgia goes through this way. But yeah, we are currently in very repressive, shrinking space and critical situation. As I mentioned, most of organizations are operating underground, continue work for others, continue documenting cases, submit to European Court of Human Rights, provide psychological, legal support, social support, my previous presenters mentioned a few times that TB patients need a lot of social supports, like with documents, with ensure access to health system, etc. And all this work are done by us, absolutely, let's say, voluntary based, because we understand it's really very important. Of course, it's less effective than it was done before, but our members, including our focal points and TB people members in regions, continue to work and continue provide this kind of work. It's just less visible, and we don't share, we don't publish anything, etc., because you know, any steps should be approved by some unclear procedure and unclear institutions which changed every month or every few months, 1 month ahead, which is impossible. And we all understand that all this legislation against the basic human rights principle and against constitution of Georgia. So we just keep going and keep working, you know, as much as we can do. So, and yeah, unfortunately, also official information, statistics, and some reports, and this work with stakeholders also changed, unfortunately, and but we used to work very effectively, and we've been among few countries of the region which have established innovative WHO, you know, recommendations, etc., very quickly, thanks to this cooperation and very good partnership with different stakeholders, etc. Next slide, please. So it's just on my slides, you will see just, you know, general information about our organization and etc. Because as I mentioned, current legislation, we try to, you know, work with less risk for members and for everyone. But as I mentioned, we continue to work, and we understand very well that to be effective and to work and to help other people, we have to think about ourselves as well, and to provide psychological support and you know, peer support to our members as well. So we are organizing some, you know, hiking, or let's say this friendship, you know, gathering together with our staff members, and we're starting usually with sharing very negative information, you know, etc. But we are finishing usually with hugs and smiling and plans for future, and plans how we will can be more effective even in this, you know, critical situation, which we understand it's permanent. It will change definitely, because not only our organization, dozens of people are fighting on different level, protesting, you know, using international mechanism, providing presentation on the international organization, you know, documenting cases and etc. But currently, one is most important work which we are also doing is we try to give hope to, you know, TB patients who are engaged in the programs, and you all understand very well how important is it. Even professionals give them perfect information, you know, etc. Have conversation with person who already went through this road, through this challenging, you know, road and time. It's so important for people to keep going, to not left the program, and to achieve, you know, positive results. So we try to continue work in this direction as well. And in terms of Global Fund programs and support, Georgia have different cycle, but yeah, unfortunately, it's only financial support, which currently organizations or service providers are getting in the country, because no local, let's say, financial support are provided from local budget or local sources, and no international support. Practically, it's maybe less than 1% international support, which currently are, provided in the country. So international support, financial support decreased. So it's all I wanted to mention today. Unfortunately, I can't share better, practices or better positive information, because Georgia, along with maybe other countries of our region and globally, are struggling and going through challenging time. But we believe everything is permanent and it will be changed, and we keep going. And yeah, so thank you for giving us space to share all this information currently.
Thank you, Mari. It's really devastating to hear about the challenges you're going through. And it's really, yeah, you said we're going to end on a sort of pessimistic note, but just listening to you gives, in a way, hope also, because like you said, the Georgian people, they are not going to accept this. You are still fighting in whichever way you can. So thank you for sharing with us today. We really appreciate that. So we are now have time for Q&A. We have almost 20 minutes to discuss, to share. I think there was a question from Nisha in the chat. I don't know if you want to ask it to Alexandra and Irina live, or I should read it.
Thank you for that. Good morning to you all. I was wondering, to the presentation from Alexandra and Irina, thank you for wonderful presentations. If peer support is offered to each patient diagnosed with TB, because you have limited peers, you have limited support possible, and how do you make the selection when to offer peer support? Or so I was wondering how you deal with this in daily practice.
Shall I answer? Shall I try to answer the question?
Go ahead, Irina, and we give the floor to Alexander afterwards.
Okay, so yes, you're right. It depends. Not all TB people can have this possibility to have a peer. It depends on their family situation, where they live. As I said, our organization is based mainly on home visits. So our peers visit at home every patient, and they, in the same time, offer DOT support. So usually those patients are chosen that have no possibility to come to the hospital every day to get the pills. It depends on their health situation, on their material situation. Some of them have no money even to get to the hospital. That's why usually we have a very good collaboration with the hospital, with the doctors, and usually they call us, the doctors, and ask us to take into DOT support certain TB patient in order to support him, because there is a risk for the person to give up on treatment for different reasons. So due to this collaboration among doctors and the organization, we managed to analyze each case separately, and in this way, we try to support those patients that need it most of all, and to offer them all the, not just psychological, but also social support as well.
Thank you. Alexander, do you want to add?
Yes. Thank you for
small question for Irina, and if she listen me. Yeah. Not question. I won't say I'm director Sperranta Terrei, and won't say. Sperranta
Sorry.
Terrei. Yes, I won't say that Irina absolutely correct about our work, but I won't say that our experience in our organization is based for beauty support, but we work very more time with people who want in treatment and not have medical education. And for today, I can say that if person finish treatment from TB, they can work, and not is obligatory to implement it work for medical assistant or medical specialist, because people from society is more the person who is with TB.
Okay, thank you for that. Alexander, you were about to also reply?
Yes, thank you for the question. But unfortunately, the peer support is not currently available to every person diagnosed with TB, especially in Latvia. Availability depends on the resources and the peer support networks in different places. And where peer support is not available, we try to provide other forms of psychological support and connect people with probably available community resources and calls and WhatsApps and stuff like that. So we believe that the peer support should ideally be accessible to everyone. That's it.
Yeah, we have to start somewhere. There is a hand from Stefan Radert, and after that, Christina Selan. Maybe we'll take both questions. So from both of them. Stefan, can you unmute?
Yes, thank you, Mona. My name is Mona Drage on this meeting. I'm Stefan. I'm sorry for confusion. I cannot change the name. I have a conclusion after the presentation. Unfortunately, after the Global Fund stopped financing in each country, it is very difficult to find a solution to continue the peer supporting services. And this is, I think it's a common issue that we have, and maybe we can keep this group, Mona, and try to push maybe with Stop TB partnership, with the Europe Coalition, with the other organization, maybe try to push to have in the region some specific financing for TB or better for peer support in TB. It is difficult for us. We lose what we want in the Global Fund projects. Thank you very much.
Christina, do you also want to come with your intervention?
Yes, thank you, Mona, and hi, colleagues. Actually, mine is also not a question, but somehow coming in response to what Stefan said. While I had a break this year, but I was following this activity very close, I saw that in May, when you had the training, it was a Stop TB partnership representative who probably talked about the peer-to-peer framework that is being developed under the Respect project, funded by UNITAID through Stop TB partnership, and PASS Center is leading this work. We are about to finalize this framework, which regulates the work of a peer-to-peer supporter, and it is adaptable for other countries. What we plan to do in Moldova is we are already implementing, also using the experience and expertise Sperranta Terrei have, Smith also has on these aspects, and other organizations we are working with here. And when also, at the same time, we'll be implementing an operational research to see and to measure the support, the impact of the support of a peer-to-peer supporter or supporters, let's say. The next step is to advocate for domestic financing to be included for this specific activity. So that's the chain of activities planned around this, but the most important part for other colleagues is that framework can be adapted to other countries. We will be able to share as well. Also probably the results we'll have in Moldova may be used as an advocacy tool for other countries to advocate for funding, for domestic funding or for funding for other donors. Thank you so much, and sorry for the background noise.
That's great, Christina. That's exactly why we have this network and this webinar, so that we can learn from each other. It's very nice to hear that a new resource is coming up that we can all take use of. There's a question in the chat for Marina. I don't have so much a question as a request to share your experience. Given that your team has extensive experience in managing patients with tuberculosis, especially those with comorbid conditions, could you tell us about your practical approaches and challenging clinical cases?
Yeah, it's as I mentioned, we had very rich, practice before. Now it's less, but yeah, unfortunately, because of this legislation currently, and because we are out of services, we don't have office currently, etc., etc. Of course, it's individual applying cases when patients calling directly to Nicholas or to our other regional, coordinators and members, and usually it's struggling with new medicines. They have less information on side effects and how to manage them, or they need additional sources for managing or managing side effects, for example, or they have some other HIV or Hep C or hepatitis B, etc., and how to manage it, and who is professional who can help with them, because sometimes they need consultations with different doctor, etc. So I mean, unfortunately, it's less effective because now officially we can't really very effectively cooperate with different stakeholders as we used to, but we still have this kind of a very good partnership with middle level professionals, health workers, etc., and we still help and support patients with this kind of information, and we give them direction on information, and we call doctors and send our patients for some specific treatment of side effects, etc. But also very important part is social and psychological support, which is also not provided because of any financial support, and we're really struggling a lot when people need psychological support and professional, and there are only few organizations or people who are continue this kind of work. In terms of clinical supports, and I mean not only cases, but Georgia used to provide a lot of clinical research in terms of new drugs, in terms of innovative drugs. Unfortunately, because of this legislation, international organizations also decreased their financial support, and most of programs are closing or finishing or are going to close in near future. Unfortunately, repressive legislation influenced everything and all spheres of our work. So, yeah.
Thank you, Marina. I think there's a very important question in the chat, but I'm not sure if we have time to address it. It's from a Norwegian colleague. And maybe we can reflect upon it and brainstorm on it later. But how do we include the healthcare workers? If patients should have been offered peer support, it's important to make the healthcare worker understand its importance. Otherwise, the patients may not hear about the peer support service.
If I may,
Okay.
we have this kind of, experience organizing patients' calls, where we usually invite health professionals, also decision makers, like NCDC, for example, representatives, which is, managing program coordinating part or etc., and patients which already went through this road, and this kind of perspective from different angles on one day. People are getting information from different angles, information about different, program part, financial part, patient, approach, etc., etc. It's really very effective, and it's, really very helpful for them, because it's not only one focused information, it's information from different sides. And and we still do it even without, with small groups, but when we have some needs, we still do it. Currently, we are going to organize about bedaquiline and, new innovative HIV drugs, which can be available in Georgia in near future. So, yeah.
Thank you, Marina. I think we're getting towards the end, unfortunately. We are going to have another webinar in a month's time. I think some of the questions and feedbacks in the chat, we should all remember them and include them in the next webinar. We wanted to have a quick poll before we end. We have 3 questions for you. We're able to get the poll up. So question 1 is, how important do you think it is to have peer support program in your context? You need to choose very important, important, or not important. Number 2, how would you rate the development of peer support in your country? It's absent, at an early stage, or advanced level. And do you have any ideas for the next steps to scale up peer support in your country? I don't see a need for any changes, or peer support needs to be expanded, but I don't yet have ideas on how to do this. I have ideas that require further discussion, or the necessary actions are already being taken. I hope those that haven't left already can answer the poll. It will give us some ideas also on what to work for in the future. And whilst we're waiting for the poll to be finalized, I just want to let you know, like I said, we will have a new webinar on 22nd September. This webinar is mainly a follow-up on the physical meeting in Oslo, where countries made 100 days plans on how to strengthen peer work in their country. In the webinar, we will discuss progress and lessons learned from implementing the plans. This webinar will be open for all, and hopefully still very useful for everyone interested in peer work. So it's not only for those that participated in the physical workshop, but the main focus will be on the plans that were made in that workshop. Unfortunately, this webinar will be in English only, but still hope to see many of you there. Do we have the results of the poll now?
Yeah, it is almost 65%. So I will show the results. Okay.
Yes, thank you. So let's end this webinar with the results of the poll. 82% think it's very important to have peer support in their context, and 18 important. 0 said no, not important. That's great. For the next question, 5% says it's completely absent, 64% at an early stage, and 31% at an advanced level. That's actually better than I thought. And ideas for the next steps, 8% don't see any need for changes. 21% are not sure of how to do the expansion. 62% says they have ideas that require further discussion, and 10% the necessary actions are already being taken. I think for me, this poll shows that there is a need for these kind of webinars. It's a need for us to get together and discuss the challenges and opportunities and learn from each other. So hope to see you again at the next webinar or in person. And thank you so much for participating, and thank you for TBEC for organizing this. Bye.
Thank you. Goodbye.
Thank you so much, dear colleagues.
Thank you
Bye-bye.
very much. Goodbye.
Have a nice day.
Bye-bye.
Yeah, and extra thanks to all the speakers. Thank you.
Thank you very
Thank
much.
you
Bye.
very much.
Thank you.
Thank
Bye-bye.
you for inviting us.